Freely this morning. My name is Olive Burrows, and we remain on the coronavirus trail and will be touching base with our correspondents across the country shortly. But first, let's take a look at the news making headlines. Now, Nairobi County continues to raise concern over the spread of the coronavirus, as 3 out of the 4 new cases reported yesterday are from the capital. The government is now racing against time to prevent the spread of the highly contagious disease that has now affected a total of 42 people spread out across 5 counties. Eunice Omolo reports.
The capital is under the weather as it hosts a total of 31 confirmed cases and as the national tally hits 42.
In our situation, in the last 24 hours, a total of 69 samples from suspected cases of coronavirus have been analyzed in our various laboratories. Out of those, we have received confirmation that 4 people have tested positive for the disease.
In just 7 days, the number of cases has risen by 26 since Monday, 23rd of March. There has been 1 recovery and 1 death, a 66-year-old male who has been receiving treatment for COVID-19 at the Aga Khan Hospital. After Nairobi, Kilifi is second with 6 confirmed cases. Mombasa reported 1 extra case out of the 4 new cases, bringing the total to 3. Kwale and Kajiado have 1 case each. Out of these cases, 24 are male and 18 female. Kenya ranks second in East Africa in the number of positive cases recorded. Rwanda has 60 patients receiving treatment for coronavirus, while Uganda has 30 patients under treatment. Tanzania has recorded 13 cases, while Burundi and South Sudan have not reported any case of COVID-19. Africa has 46 countries and 2 territories affected. The latest number showing 4,390 positive cases reported, 139 deaths from 20 countries, and a total of 244 recovered cases. Countries with the highest numbers of cases include South Africa at 1,187, Egypt with 576 cases, Algeria with 454, Morocco with 450, and Tunisia with 278 cases. Globally, the pandemic has afflicted 199 countries and territories with 683,835 cases reported, 32,168 deaths recorded, 146,397 people have recovered from the highly contagious disease. Today marks the 16th of the daily update by the government on the spread of COVID-19 in the country. And in less than a month, the country is almost hitting the 50 mark of the number of positive cases reported in Kenya, while globally, the number of positive cases are 300,000 shy the 1 million mark. Eunice Omolo, NTV, Nairobi.
Immoral and unethical. That's Health Cabinet Secretary Mutahi Kagwe's assessment and condemnation of a long Twitter post by Dagoretti South MP John Kiarie, alleging the government's untruthfulness in the number of coronavirus cases in the country. The MP was yesterday summoned by the DCI to provide more information on his claims, including an allegation that there are more than 7,000 people in forced quarantine, contrary to the government's figure of 2,500. Here's NTV's Ken Mijungu with those details.
This long thread posted on Twitter containing information on the coronavirus, which now the government flags as misinformation, is what has landed Dagoretti South Member of Parliament John Kiarie at the police station in Kabete in answer to summons by the Directorate of Criminal Investigations.
Sheria haijui mkubwa ama mdogo. Ukiwa umevunja sheria, utashtakiwa.
In an explosive rant, the legislator accused the government of downplaying the extent of the spread of the coronavirus. He claims there are more than 7,000 people in compulsory quarantine. The government now says his numbers are overly exaggerated, the information obviously false and alarming.
It is really, really wrong and disheartening for those particularly in leadership to continue perpetuating false information that have got nothing to do with the real cases, trying to gain political mileage.
We are doing what is in our power to do to this response. You understand that funds like NGCDF are not able to react to such an emergency.
According to the Ministry of Health, there are only 2,050 individuals under compulsory quarantine. These are close contacts of those who have so far tested positive and they are in close observation.
Huwezi kusema uongo. Sana sana kulingana na vile tunaona, wewe uanze kuambia watu ati iko wagonjwa wengi kuliko wale tuko nao. Alafu unafikiria hiyo maneno itaenda tu hivyo hivyo. Sasa tukiruhusu watu wafanye hivyo jameni.
The government now wants politicians to keep off health matters and wants those peddling false information that action will be taken against them.
Ukiwa mwanasiasa, kama mimi ni mwanasiasa, tafadhalini, sisi wanasiasa, kwa wakati huu, washeni tuweke usiasa upande, tuwashie madaktari wasungumze habari ya hii ugonjwa, hii virusi, kwa sababu wewe sio daktari.
John Kiarie, aka KJ, a comedian turned politician, becomes the third Kenyan to be in trouble over publication of false information. 2 bloggers are currently out on bond following the publication on social media unverified, alarming, and information the government says is false regarding the coronavirus. Ken Mijungu, NTV.
I mentioned earlier that we have correspondents across the country on the coronavirus story, and we're now joined by Kevin Mutai. He is at the Likoni ferry. Kevin, what is the situation there? Are people keeping a social distance, and how are they being handled by the authorities?
Well, good morning to you, Olive, and that is the reality that is sinking in, especially when we come here at the ferry. Commuters now considering and following the government's directive and maintaining social distancing, and this has also been taken as one of the key areas of great concern by the authorities, the health officials. And of course, they are always here to make sure that commuters at the crossing channel maintain the social distancing. You can see that some of them are currently from the Likoni channel, as well as some are also boarding the ferry towards the other channel. But currently, right now, the traffic is on the other side, and residents have been given priority. And this is according to the new measures that were put in place after leaders and the law enforcers met, and there are specific guidelines that are currently working here in the crossing channel. And as I said, that the common mwananchi, the commuters, those who are traveling on foot, have been given priority, and the ferrying of vehicles will begin at 11 to 2, and of course also those with special access have been granted permission to cross, and those include medics and every other institution that has been classified as essential service provider. But let me quickly bring in the Mombasa chairman for the Kenya Red Cross, Mohamed Noor, to just give us and bring us into perspective on how these current measures are working. We've seen different measures being implemented here from Friday. Is it working so far in terms of the congesting traffic from the crossing channel?
After the issues that we were trying out last week, today will be the first real test for us because it's a Monday. So Monday we expect a lot of people to cross on the other side. So as from yesterday we started the new measures where we between 5 in the morning until 11 we only allow pedestrians, because we know most of the users who come in here are pedestrians. And then from 11 up to 2 p.m. we allow vehicles only, and then from 2 p.m. we concentrate on the island side to take people back to the mainland. But in between we also have special provisions, like for fresh produce we allow the trucks to come in between 7 and 7:30, and also because of the high tide, the only time that the big trucks can cross is when it is during the high tide. So we've also allowed that to work out at 10 in the morning.
And then again, as at yesterday, the government confirmed 4 more positive cases persons infected with COVID-19. That brings the total number to 42. Now the challenge is now tracing the persons who had come into contact with these already confirmed cases. It's a big challenge to the health authorities. How far are the officials here in Mombasa in terms of tracing the persons who came into contact with the cases here in the coast region?
We have a team that is multi-agency, which also the Kenya Red Cross is part of, being spearheaded by the county government because they run the health docket, the public health department, and also the security and national government. Because the only way we will be able to win this war is by tracing the people who have come into contact with some of the affected persons. It's a very tough work, because if you consider the confidentiality whenever you are dealing with health cases, but we wish if it was not for that, even publishing some of the names or sensitizing people, like you see the DG's case, after it came open because he's a leader, a lot of people now are coming to us and saying, I was in contact with him on this particular day, I was eating nyamachoma with him on this day, I served him on this day. So I wish there was a way, but I think that also the health workers are constrained in terms of the laws. They cannot disclose some of these names. So we entirely rely on the persons to give us information on the people that they have come across.
When you look at the entire coast region, we have 6 cases in Kilifi, 3 in Mombasa, and 1 case in Kwale. That brings the total number of infected persons in coast region to 10. And health officials are raising concerns. Perhaps these numbers could increase exponentially. And when we bring that perspective to here at the Crossing Channel Ferry, where hundreds and hundreds of commuters depend on these services daily to cross over, what are some of these measures that you've put in place as part of the key stakeholders to ensure that the spread of this virus is kept at bay, especially and specifically when we speak about here the Likoni channel, because this is where a lot of people are crossing at once every day?
For me and also for the government, I think there is no place in this country as the Likoni ferry, where you're having a concentration of around 10,000 people every 1 hour and exposing them to the virus. So be it. So what actually we will want to let the people know, safety starts with them. As long as people are being forced by the security personnel or the people who are enforcing it here to wear masks, then we have a problem. As long as people are being forced to keep the social distance, then we have a problem. I think what we need to encourage our people is safety starts with you. So follow the regulations and the rules that have been put in place, not for the government, but you are doing it for yourself.
I'm glad that you're bringing that point, because we've had challenges reported by the authorities, the law enforcers. There's a total disregard by some of the commuters who are constantly defying some of these measures. This could probably punish maybe other commuters who are following these guidelines, because as I can see right now, quite a number of them have face masks, but there are those who don't have. Don't you think they're also exposing, perhaps even creating more danger to those other persons?
I think we need to sensitize our people more. I think there are so many rumors that are moving around, and some people still believe that this coronavirus is not for them. We need to sensitize people more. We need to show people the images of what is happening in Italy, in Iran, and also in other parts of the country. But most important, we need to use all the existing networks to talk to the people and sensitize them. I know there are so many concerns and that people feel there are some areas where they are still lumped up together, but every day we will be improving, but our people must learn that COVID is real, and if you do not take that personal safety upon yourself, then even the government forcing you, because I will force you here at the ferry, but when you are across there at your own home, you are doing something different. So people need to understand that we have this, we are vulnerable, and especially for this crossing, because I will call this the center for coast, because it connects Kilifi. A lot of people who are coming here are coming from Kwale, So when we have a problem at the ferry here, then we will have a catastrophe in the country.
And then again, you know what we witnessed on Friday last week when it comes to traffic. There are certain commuters who defied the orders and they ended up in the wrong way with the authorities. There was a stampede that even led to several other people being injured because of a few individuals who could not follow the orders and guidelines as required by some of the law enforcers. So today is on a Monday, and we're expecting perhaps the traffic could be probably maybe even worse in the evening. Are there any specific measures that have been put in place to avert whatever occurred on Friday?
As I said earlier, every day we are learning. Every day we are because this has never happened probably even for 100 years. So this is the first time. So what we are doing, the measures that the government is putting in place in consultation with a lot of other stakeholders, is whenever we see there is a room for improvement on a particular area, we improve. So our hope is today we will be more prepared. I think even the law enforcers are more prepared, even in their response. But most important also, we just hope that the people will also not instigate some of these issues by trying to break the laws. But most important for our law enforcers, it's good for them to have a response that is not extreme on the other side. Yeah, but for the meetings that we've attended all through, led by the regional commissioner, the police and different agencies, including the county government, I think we've put in measures and we are very flexible to change some of them so that we avoid to accommodate special things that come up. Yeah.
And then again, when we look at, when you talk about the tracing of the contacts that had, the people had come into contact with some of the positive cases that have already been confirmed, we look, these numbers could probably maybe even go up. And here we are talking about people who have been in self-quarantine maybe for the last couple of days, maybe even weeks, maybe some are even getting into their first 14 days of mandatory self-quarantine. And perhaps maybe the government is now set to conduct mass testing. Do we, I believe you are also kind of involved in, maybe you have some knowledge or some information on how this perhaps will be conducted. Are we ready? Do we have the necessary equipment, enough equipment to ensure that when that particular exercise comes in, or rather begins here in the coast region, that everything will be good and go, will be good to go? Do we have proper equipment and enough equipment in place?
I think for testing, whatever the CS in Nairobi, Mutahi has done so far, and the government in general, and also last week he announced the 20,000 testing kits that came from China. So on the government side, I think the preparedness is there. The biggest challenge that I foresee is, for example, the whole of Coast Province, where we are serving almost 4 million people, we only have 40 ICU beds. The biggest problem is ventilators, and it's good that the minister spoke of bringing around 1,000 ventilators, because that will be the best problem. But for me, why we should stop? We should not try and reach that level, because once we reach that level, if countries like Italy and other better equipped countries are not coping, then we cannot cope. So our best way is to stop it from spreading now.
Thank you so much for your time. Well, all of you heard it. That was Mohamed Noor, chairman the Kenya Red Cross here in Mombasa. He's part of the key stakeholders together with his team sitting with health officials, the law enforcement officers, to ensure that the key measures that are being put in place will help in keeping keeping the deadly virus at bay. And of course, also we are still monitoring several other places within the county. Remember, Coast Region has 10 confirmed cases. Kilifi County leading with 6, followed by Mombasa County with 3 cases, then Kwale County with 1 case. And remember, the government is still continuing with the tracing of other people believed to have come into contact with the confirmed positive cases. But of course, also the health authorities are appealing to members of the public to come forward with information to also help health officials to make their work easier in tracing these individuals. But remember, also I've also read in the papers that there are also some members of parliament, I don't know if some are from this region, that are currently or rather they've been recommended for testing. And remember, this is something that health officials, the law enforcers, are recommending for everyone to take preventive measures and of course follow the guidelines outlaid by the Ministry of Health and of course the government to ensure that they stop the spread of the virus. So we will be here, we'll be traversing different places in the coast region, not only here at the crossing channel, but of course we will be bringing you up to speed on what you need to know with regards to the government efforts in curbing the spread of COVID-19, which has so far infected 42 people here in the country, and of course has also contributed, or rather led to the deaths of thousands of other people globally, with thousands others infected. Olive, back to you in studio.
Thank you, Kevin. I saw all sorts of masks there, gas masks, and some people improvising bandanas as masks. Perhaps Kevin can find out for us whether or not they are also effective. Well, now we cross over to Nyeri, where Melita Oletenges is standing by. He's speaking to some traders, if I'm not mistaken. Melita, are they operational? We've seen some markets across the country shut down. Are they observing social distancing? Are their vegetables, if that's where you are, propped up on a stand? And do they have access to water and hand washing stations?
Right, 3 nights into the curfew, dusk to dawn curfew, and the effects of the curfew have already started to bite. I'm here at the Nyeri town center. I'm going to be speaking to a number of border operators who are saying that their income has suddenly gone low or diminished, and they're saying that they're already feeling the heat of this curfew. And we've been to the market, we've also been to the Nyeri bus terminus, and clearly residents there are saying that although they are observing the curfew and also observing social distancing and washing of hands, they are saying that already they feel that their income has been affected one way or the other. Remember, these are people who depend on the daily wages, and just to shed more light on this, I'd like to speak to a border operator here. Thank you so much, sir, for joining us on NTV. Pengine kufikia sasa hali iko vipi?
Okay, my name is Junior Mwangai. I'm a motorcycle operator in Nyeri, specifically Gakere Road. To me, I believe curfew has beaten so deep in our pockets, because most of the times when we get customers between 7 and 9 o'clock, that is the time for the Holy Grail. And we get a lot of money during that time. In fact, that's the time we recoup losses of the day when we have worked, maybe eaten, put fuel and petrol in our motorcycles. So when the curfew comes between 7 and 9, that is when we get most of our times. So it has really affected our earning power so much. But also, I believe as in Nyeri, we are very, very careful to observe these curfew hours, because I've not heard of any incidents of the police brutality in Nyeri, because people are going home early. I also believe we should take this curfew seriously, because a lockdown will be just a murder to us, because we depend on a day-to-day basis money to get our food and our upkeep. So if it comes to lockdown, it's going to be very easy. And as the numbers are rising of the coronavirus, I believe the government might take the next step for the lockdown, which is going to be very, very hard, especially for people who do small-scale trading and motorcycle operations in Nyeri. Yes.
And perhaps also you operate at night mainly. This is when many of the border operators are actually active. Perhaps how do you survive at the moment? What do you do actually to earn your money?
In fact, most of the border operators who really operate during the night, they have started to operate during the day. And this brings so much crowd in the motorcycle operations. And that means the number of motorcycles compared to even the number of people, the motorcycle is higher. And so the money even goes down. This really creates a round effect. If you don't have enough money, you don't spend enough. And that goes to the vicious cycle. You don't have money, you don't spend much, and the economy becomes depressed. Yes.
And perhaps what can you say about how the county, as a resident now, how the county is prepared? They're saying they are prepared to actually handle the pandemic. What are your sentiments about that?
Yes, I would like to thank God that the coronavirus has not even arrived in Nyeri County, because I've had the preparedness of Nyeri County. They have put some places, especially Mount Kenya Hospital, where the people should be taken, and some of the places in the PGH General Hospital. So I believe county is really prepared if the corona cases comes. But I would pray to God that it does not really arrive in Nyeri County. In fact, I would pray the number to start slowing down, going down, people getting less sicker, so that we don't come to the next option of the lockdown, which will be very, very, very hard. For the first 3 days of lockdown, probably it will be okay. But after the 4th day, most of the people, that small amount of money you have put and the small amount of food in your house really goes bust. So probably there's going to be social chaos when people come out angry and very hungry indeed.
Yes. Thank you so much. Allow me to speak to one more resident here. Thank you so much. Pengine ukianza na jina lako kisha utuambie tumekuwa tukiwa katika marufuku na sasa tunaelekea usiku wa 4 hii leo. Pengine wewe maoni yako kuhusu jinsi ambavyo hizo usiku 3 zimepita zimekuwa vipi?
Mimi naitwa Michael Degwa na mimi ni mfanyabiashara na usaga viazi. Na kulingana na vile tuliambiwa na maaskari ati tufunge biashara yetu, tumekuwa na shida sana. Tukisema Mudhurwa na St. Mary na watu wa Mearero, tuko na njaa sana kwa sababu tuliambiwa tufunge biashara zetu na hatukupewa pesa za kutusimamia. Wangefanya hivi, watuambie tuende hata kama ni wiki 2, tulikuwa tayari kuingia kwa nyumba tukae wiki 2 na tusiwe na tupewe pesa za kusimamia wiki 2. Sasa sisi tuliambiwa tufunge biashara yetu na tumekaa siku hizo kama siku 4 na hatujapata kitu. Sisi watoto wetu, ujue watoto wetu wanahitaji chakula na sisi hatuna mahali kwingine tunatafutianga watoto chakula kuliko pale kwa biashara. Sasa sisi tunaomba serikali kama ni curfew, sisi tutafuatilia curfew ya saa 1, lakini tukubalishwe tuendelee na biashara yetu kama vile tulikuwa tunafanya hapo mbeleni. Sina mengi ni hayo.
Pengine kando na hayo vile sasa hivi jinsi ambavyo umefunga biashara zako, pengine mapato yako unapata vipi ndugu yangu?
Ni kusunguka tu kwa manyumba nikiuza viazi, lakini sina uwezo mwingine. Kusunguka kwa nyumba, pikipiki inakunywa petroli mingi juu ya kuenda kwa manyumba ndio nipate chakula ya kila siku. Sina uwezo mwingine, lakini mimi naomba turudi kama vile tulikuwa tunafanya biashara. Tutafuatilia sheria, hata kama ni kunawa mikono tutanawa. Kama ni distance ya social distance hapo tutaweza. Lakini kwa wakati huu tuko na njaa sana kwa biashara. Mimi naomba tupewe ruhusa ya kuendelea tu na biashara ile tulikuwa tunafanya hapo mbeleni.
Pengine nizungumze na mwingine hapa. Bwana, ukianza na jina lako kisha utuambie maoni yako kuhusu marufuku iliyoko na imepita siku 3 sasa. Unaweza sema nini kuhusu hiyo?
Mimi naitwa Kilonzo mimi ni mwenyeji wa Nyeri. Mimi kulingana na mimi hii curfew si mzuri juu mimi naangalia vile watu kwa social media na through TV vile watu wanafanyiwa. Hata unashindwa tunaishi Kenya ama tunaishi kwa msitu. Juu raia mtu unaona vile mtu akichelewa vile anachapwa ni kama mnyama. Na mimi kile naweza omba ni raisi na through intelligence na security, kama ni mtu amechelewa kwanza wakisimamisha mtu amuulize vile amekosea. Kama labda ni kuchelewa amechelewa, labda akipeleka mtu hospitali kwanza wajue, then kutoka hapo wajue what next, kuliko akisimamisha mtu ni kuanza kumchapa kama mnyama. Sisi zote ni binadamu, na hata kama ni askari akichapa mtu ajue yeye ni binadamu kama yeye. So at least ukisimamisha mtu kwanza ongea na yeye ujue mahali amechelewa, juu binadamu si mwenda wazimu. Kama amechelewa kwanza muulize, ukimuuliza then after that wacha kama amechelewa kimakusudi mshike, peleka yeye polisi, then after that sheria ichukue mkondo wake. Then kutoka hapo na maneno ya hii curfew, biashara mingi saizi zimekuwa affected so much. Juu ukiangalia kama ni mtu ameajiri mfanyikazi anafunga kazi mapema sana, na then akifunga kazi mapema sana inakuanga effect hata kwa Kenya. Juu mtu kama amefunga kazi, ameajiri wafanyikazi, amefunga kama masupermarket wanafunga kitu 5, na hao hizo 5 ndo zizi tunatokelezea kwenda kununua vitu tukienda nyumbani. Hakuna kazi wako nayo. So mimi kile naweza omba hata hii curfew president at least atuondolee curfew, at least tufanye kazi juu sisi watu wa kiwango cha chini sana hatuna kitu that is.
Pengine Nyeri ni mojawapo ya miji ambayo pengine imeweza kuangalia hiyo marufuku na kabisa kufuata kanuni za serikali. Watu wanaenda nyumbani mapema sana. Pengine wewe kama mfanyabiashara, hili kando na kuwa umesema inakuadhiri kiuchumi, sasa mapato yako unapata vipi?
Mimi mapato yangu iko chini kabisa juu kutoka last week on Tuesday Ndo kama hapa Nyeri tulibaniwa kufanya biashara all the way from PGH Gakere Road. Sasa hatufungui kazi, hata ile mapato tunapata labda mtu ni kwaso tu pate 20 bob ama 50 bob ya kununua maziwa. Sasa unaweka hayo mengine, Mungu asaidie. Sasa mimi naona imeni affect sana, na mimi kama kile naweza omba saa hizi president atusaidie juu tumeelekea mwisho wa mwezi. Curfew ndo hiyo, kazi ndo hiyo tumefunga. Sasa mimi najiuliza, sasa hata nyumba tutalipa na nini? Maji tutalipa na nini? Stima tutalipa na nini? Hata yeye atuhurumia, ongea na ama landlord. Kwanza hata kama ni miezi miwili ama miezi mitatu tusimamisho, tutalipa tukatai. Kama ni end month ikifika hiyo after 3 months tutalipa hiyo rent. Kwanza tupate chakula tu ya kutukidhi mahitaji yetu kwa nyumba.
Asante sana Kilonzo. Let me speak to another bodaboda operator here. Ukianza na jina lako kisha utuambie wewe, siku 3 zimepita marufuku, imekuwa vipi?
Kwa majina naitwa Jason Maina, mimi ni mhudumu wa bodaboda huku Nyeri County. Na kwangu hii curfew imetupeleka mbio sana. Juu kwanza sisi wana bodaboda, most of us tunafanya kazi usiku ndio tujikimu kimaisha. Hapo sana ndio tunapata customer wenye tunapeleka nyumbani wenye wamefunga makazi, lakini sasa kulingana na curfew yenye imewekwa na serikali, watu wanaenda manyumbani mapema sana. Hatupati customer during the day, tunakuja hapa tunashinda the whole day, hakuna customer, hata ukipata unapata 200. Sasa tunajiuliza maswali. Hii 200 shillings itatusaidia na nini? Kwanza kwako unatakiwa na chakula ukule. Pili uko na rent unalipa. Tatu hata wewe mwenyewe kuna pesa unataka za kununua kitu kama sanitizers, sabuni na maji, hizo vitu zote. Sasa tungeomba serikali ipunguze hii ukali ya curfew. Yes, hatukatai, ni nzuri, lakini hata kama wameiweka ni ya usiku haitusaidii. Juu still mchana ndio kuna locomotions nyingi za watu, movement ni nyingi sana town. Kwa hivyo hata ugonjwa sio ati spread, still ina spread tu. Yeah.
Thank you so much. You've heard from a number of residents of Nyeri County there highlighting their grievances, saying they are complying with the curfew here, but still they're feeling like it's biting, and they're saying that right now they are just surviving on the minimal wages that they get, and they, as you've heard a number of them saying they don't get enough to sustain their living, and they are saying that they do not know if the curfew continues, how they are going to survive. They've mentioned a number of measures that they are suggesting the government should do. But remember, this curfew is also supposed to stem the spread of COVID-19. So the residents are caught in between, also avoiding the spread and also surviving. So these are just a number of sentiments coming from Nyeri. Of course, we will be keeping a keen eye on this story, and we will be letting our viewers know everything that unfolds from this part of the country. But for now, over to you in studio.
All right, thank you, Melita. And from Nyeri County, we cross over to the capital city, where we have Vincent Odor standing by outside, rather within Parliament's precincts. Vincent, what do we expect from there? You know, the president challenged the legislators to enforce certain measures that he announced in the effort to curb the effects of the coronavirus on the economy. What do we have to look forward to?
Absolutely. Parliament, specifically National Assembly, is expected to have a special sitting this week, probably earliest on Thursday, to deliberate on and consider some of the proposals that were put forward by President Kenyatta to shield the economy against the negative effects of coronavirus pandemic. What I can tell you is that today, National Assembly Majority Leader Aden Duale is expected to meet with the National Treasury Cabinet Secretary Ukuru Yatani to basically be briefed on some of the proposals that the president put forward, also to be told on how they are supposed to move forward with them, and also maybe basically to receive some of the bills that will have been prepared by the National Treasury regarding these proposals. And it is thereafter that the National Assembly Majority Leader will now write to the Speaker of the National Assembly, Justin Muturi, requesting for a special sitting, because, you know, right now members of Parliament are on recess. And if the Speaker will accept, now the Speaker is the one who will summon the members of Parliament to come and attend that special special sitting. And remember, if maybe let's say the majority leader does that today, and then maybe the speaker summons members of parliament tomorrow, you don't expect to see the members of parliament here on Wednesday, because when the house is on recess, most or majority of the members of parliament, if not all, are normally in their constituencies, whereby they are serving their constituents. And therefore, if you call them back, you will need to give them time also to be able to travel back to the city to be able to attend these special sitting in the chambers. And therefore, the earliest that this special sitting can happen, if it is to happen this week, is on Thursday. Probably some of the things that we expect the members of parliament to deliberate on as far as the proposals that were put forward by President Kenyatta are concerned. You remember President Kenyatta instructed the National Assembly, President Kenyatta instructed the National Treasury to ensure that all employees who earn less than 24,000 shillings per month are able to be given 100% tax-free or tax relief, and also to ensure that those who earn more than 24,000 shillings per month are able also to pay a 25% pay-as-you-earn tax, down from the current 30%. We also know that President Kenyatta also proposed that VAT be reduced from 16% to 14%. He also said when it comes to these micro, small, medium enterprises, their turnover tax should be reduced from 3% to 1%, and that means that small businesses will now be able to only pay 1 shilling for every 100 shillings they make from their gross sales. Also, another thing we know the president wants to be done is to ensure that the National Treasury, also when it comes to the elderly, the orphans and other vulnerable members of our society, are able to be given an additional 10 billion shillings as in form of cash transfers to be able to cushion them. We also know companies, when it comes to companies, they also get a reduction when it comes to corporate tax from basically 30% to 25%. And there are a number of measures, including the cuts that the president made when it comes to the executive, also when it comes to other top civil servants. And these are some of the proposals the members of parliament will really deliberate on and decide and be able to anchor them on law, because they have to have a legal foundation and anchor them properly in law so as to ensure they are legally enforced. But remember, also, as we are looking forward to have this special sitting this week, there are challenges ahead, because challenges ahead that have normally been caused by this ongoing coronavirus pandemic. Because now, when you ask the members of parliament to come and attend a special sitting, there are challenges to do with how will they ensure they are able to keep social distancing, because the chambers, the members of parliament are many. So we will look at how the House Business Committee and the leadership of the House will ensure that even when members of parliament come for this special sitting, they will be able to maintain social distancing. And we'll look also forward to see, if they are supposed to come, how many members will be allowed in the chambers, so as to ensure they keep social distancing, and also to ensure that members will not contract this virus or will not spread this virus. And that's a challenge that right now we are waiting to see how they are going to implement, or whether it will be done in shifts, so as just to make sure that they are able to also maintain the measures of the Ministry of Health together with the World Health Organization, even as they try to conduct their business. For quite a while now, especially when you look at the past few days, we've seen majority of Kenyans, or a number of Kenyans, have been criticizing members of parliament, legislators, for going silent and keeping quiet during this coronavirus pandemic. And also we've seen a number of Kenyans criticizing some of the members of parliament for spending their time on social media and social media platforms, also complaining and whining like other Kenyans, as if they are ordinary Kenyans, yet they are legislators who should be thinking of some of the legislations they can do, or some of the bills they can work on to try and cushion Kenyans against this coronavirus pandemic, or also provide a way forward, because Kenyans feel that when or during good times, members of parliament always bring themselves out as people who understand what Kenyans go through, people who understand the problems dogging Kenyans, and therefore they are people who normally purport to have solutions to all the problems dogging Kenyans, and therefore they are expecting members of parliament right now during this coronavirus pandemic to be able to be in the front line in terms of their responsibilities, in terms of legislations, bills, to ensure that they are able to come with solutions to problems right now on how to move forward and also how to contain the spread of coronavirus in the country. And therefore, this is something we are looking forward and will be able to know moving forward in terms of the House Business Committee, because when there is a special sitting as far as the House is concerned, the agenda is normally one. The agenda do be that one agenda that they've been called to deal with, and thereafter they'll be able to go back to recess. And therefore, during this special sitting, the only thing members of parliament will deliberate on and consider are the various proposals that President Kenyatta has put forward, especially those that are geared towards cushioning Kenyans and also cushioning the economy against the negative effects of the coronavirus pandemic. And also maybe we expect some members of parliament to also come up with a number of proposals that can also be enjoined together with the proposals by the president on the best way forward to cushion Kenyans and also to ensure that really the economy doesn't get hit. Because, you know, during this pandemic, a number of sectors will really be hit hard. And among the sectors that are likely to be hit or to bear the biggest brunt as far as this pandemic is concerned is the flower sector, you know, also the tourism sector and also the aviation sector. You know, these are among the sectors that are really bearing the biggest brunt of the negative effects of the coronavirus pandemic. And we've seen also a number of companies right now, business has gone down, SMEs also are experiencing, decrease in revenue and also business going down. And a number of companies have even asked some of their employees to remain home, and even some small and medium enterprises even are in trouble moving forward on how they are going to pay their employees because there is no revenue. Business has gone down, and these are some of the things that Kenyans expect these legislators will really come up with a good way forward moving forward. For now, Bunge or Parliament is on recess. As you can see, it's very quiet, and I've just been able to see a few staff here in Parliament who are doing some essential work, like cleaning and keeping the place clean for the members of Parliament. The moment they come back, the house will be in order. But I haven't seen a majority of workers here at Parliament working from home or at home, and therefore those who are within the precincts of Parliament or in Parliament are those ones who are doing the essential services, like cleaning and putting the place in order. That is it for now. For now, I'm taking you back to the studio. I am Vincent Odur.
Thank you very much, Vincent. And Vincent joining Kenyans in demanding less talk, more action from their legislators in the face of the COVID-19 pandemic. We now cross over to Bungoma, where Zacchaeus Masame is standing by. Zacchaeus, residents, they're happy with the interventions that have been put in place by the national and their county government.
Well, thank you. Good morning to you, Olive. We are coming to you live from the county of Bungoma here. We have mixed reactions. We have those who are happy with the measures that have been taken by both the national government and the county governments. And then we have those who are feeling otherwise. They are saying that the measures could be punitive in one way or the other, especially those in the small business enterprise, the SMEs and the border sector are saying that most of them have been depending on people coming from late work, and there are those who have been doing the job at night, and they're feeling the pinch. They're feeling actually the effects of this virus down here in the grassroots. They are saying that they are also expecting maybe the worst, because the numbers, as you have seen from the updates from the minister, are getting up at least by 3 or 4 in each and every day. And therefore, it's a very big worry. And we want just to hear from a gentleman from the border sector here in the Bungoma. What is the feeling? Is he prepared for the worst? Have they adjusted to the new measures? How is the curfew taking them now that this is the 3rd day of the curfew? Gentleman, what's your name and how do you feel about this curfew? Are you prepared? How is the business? How is the border business has been for the past 3 days of the curfew?
Yes, thank you very much. My name is Martin Mkavana. I am Martin Mkabana, and I'm a boda rider from Bungoma County. I think the coronavirus issue has affected the world, or at large this Kenya, because in the business sector we have been affected owing to the issue of finance, because right now there's no business. We don't have people around who are moving. We don't have money circulation. The money circulation has been affected, and people are not moving around, so there is no money. Na ukiangalia hata kwa upande wa usalama pia tunahofia, kwa sababu ukiangalia hii maneno ya 1 meter spacing pia inaleta shida. Kuna wale ambao hawazingatii na inaleta shida kabisa. Unavyoona mimi venye nimevaa, najua hii hali ya coronavirus iko na shida. Ukiangalia kwa nchi kama za kina Italy, za kina US right now, janga la corona limeharibu sana. Na mimi ningependa kusema serikali ili tuokoe sisi as early as possible. Mimi nilikuwa naonelea kama inawezekana watu consider watu wote, kwa sababu tunapolia sisi tunasema hatuna chakula. Tukisema hata tukae nyumbani, tunakaa nyumbani tukifanya nini? Tutakula nini? Lakini kama wangeleta lockdown mapema saa hii, ingetusaidia. Bora wa provide chakula kwa kila mtu, kwa sababu tunavotangamana hivi huwezi jua unakutana na nani. Sisi watu wa bodaboda, unaposhikwa customer na kushika akipanda, anaweza kuletea ugonjwa. Ukienda nyumbani unapata uko affected ama umeaffect familia yako. Kwa hivyo mimi naomba serikali itusaidie kila mtu, kwa sababu ugonjwa haichagui wewe ni nani. Na pesa ambazo tunatumia kwa exchange every day, hiyo ndio inaweza leta shida katika dunia hii. Kwa hivyo mimi ninashukuru pia serikali kwa mikakati ambayo imeweka angalau kukumbana ama kupambana na hili janga la corona, na ninasema waendelee hivyo. Na pia serikali itusikie pia sisi watu wa chini, kwa sababu sisi tuna mawazo yenye inaweza kutusaidia, lakini it's only that we have not been given time, or we have not been given that chance to air out our views. Because kama wanaweza kutupea nafasi ya kuongea na kusikika, I think tunaweza saidiana kama Wakenya, kwa sababu sisi sote tuko affected na hii kitu. Uwe mtu mkubwa, uwe mtu mdogo, sisi sote we have been affected by this COVID-19 janga, and we want help. Tukiangalia upande wa groups, ninashukuru serikali kwa sababu wametusaidia. Jana hakukuwa na kanisa, hiyo pia itatusaidia.
So much, gentlemen. I'll wish that you move around away so that I can also talk to another Kenyan here. Just move away. Thank you so much for talking to us. Gentlemen, your name, what do you do in Bungoma, and how do you feel about these effects of corona in Bungoma?
My name is Geoffrey Sabuni, and I'm a resident in Bungoma. I stay in Bungoma, I work in Bungoma. First of all, I would like to thank the government for what it has taken place about keeping this corona out of these people. Naweza sema kwamba corona hii ni ugonjwa ambayo imekuja imeaffect kila mtu, na sisi watu wakazi wa Bungoma imetuaffect kwa biashara zetu. Tumejaribu kufanya biashara, lakini most of us wale wa biashara ya chini, small scale business, tumekuwa affected kidogo.
In which way?
Ya kwanza, watu wote wameenda nyumbani. Some of them are in self quarantine. Some of the NGOs, companies and county government, that is what tunategemea kufanya kazi. Na zote wameenda nyumbani na wamekaa nyumbani. Sasa sisi weje tunafanya biashara hapa town tunaumia. Na isitoshe tunajaribu kuangalia serikali pia iangalie upande ya street children. Maneno ya curfew imekuja imewaffect sana. Most of them, they don't have somewhere to stay. They don't have somewhere to hide. Ama askari wakikuja ni viboko, they go home. Where they are going, we don't know. Sasa ndio tulikuwa tunaomba serikali ya county iweze kuhakikisha imewachukua wote na imewaweka kando. Imewaweka mahali pamoja. I can hear that Nairobi huwa wanakaa kwa garden fulani. So I don't know which garden is that, but Bungoma hapa hatuna. Tunaomba serikali ya county iwachukue na iwaweke kwa either kwa makanisa ama kwa shule moja ili waweze kung'ang'ana. Na kwa biashara ya wamama sokoni, serikali ya county imeng'ang'ana, imeweza kubambana na hii COVID-19. Imeweza kubambana nayo na imeweza kuweka curfew. Hawa mama wote wasiingie sokoni ili wasiweze kukumbana na hii ugonjwa. Lakini ninaomba serikali ya county iweze kufanya mikakati. Hawa mama pia wanataka kukula. Wanataka kufuga watoto wao. Na wanataka kuweka mikakati ya kuona vile watoto watasoma. Sasa ndio tunaomba serikali iweze kuwatengea mahali na iwawekee space. They keep distance plus the customer. Wenyewe wana keep distance na space inakuwa kept distance. Sasa yeye na customer hawapatani. Na wao serikali iweze kuwa supply na masks, gloves. Hawa mama hawezi nunua kwa chemist hapa, masks zimekuwa expensive. Gloves zimekuwa expensive. Akinunua mask na glove hana profit ya jioni. Unaona? Sasa serikali ya county iweze kuangalia hiyo kitu na iweze kuwaweka pamoja.
Okay, thank you so much. Those are some of the views of the residents of Bungoma here. And you remember that you mentioned the issues to do with the county governments. We have been going around. We have been in Busia, in Kakamega, in Vihiga, and in Bungoma. We have seen that the county governments have at least tried to put the sanitizers at least at every entry point in market centers to make sure that anybody who comes in is able to wash his or her hands before carrying out any other business. And therefore, it is some of the measures that we are also keeping an eye to see. Later in the day, we also have a weekly briefing from the governor of Kakamega, weekly Fambetsa Oparanya. He does that every week on Monday and Wednesday. Wednesday as the COG chair, and then on Thursday as the governor of Kakamega. And therefore, we will also be heading to Kakamega to make sure that we just have an ear on what he will be saying. This county of Bungoma is also prepared in a way to make sure that they sensitize the residents in making sure that they keep the COVID-19 at bay. And therefore, from here in Bungoma, my name is Zakis Mwasame, and now back to you in studio.
Well, as the number of positive COVID-19 cases in the country increase, the focus is shifting to hospitals. The government says it's done all it can do to deal with the outbreak, but there are fears that the healthcare system could be tested if the number of infections explode. Health Cabinet Secretary Mutahi Kagwe says there are slightly over 1,000 ICU beds to cater for the most ill. But the government is still banking on citizens to help flatten the infection curve, as NTV's Kennedy Mureithi will report.
The threat posed by the coronavirus here in the country is manifesting itself in the numbers that continue to soar daily. On Monday this week, the country had a tally of 16 confirmed cases, but starts a new week at 42.
So we know that going forward, it is indeed very likely that our health facilities can and could be overrun by just the demands. And this is why we are saying this is not a government issue alone.
To this end, the government is now looking inward as it prepares for any eventuality.
We need to be looking as communities, in your villages, what are the secondary schools, particularly boarding secondary schools, that we can begin to identify as potential areas where we can keep the sick if the situation overruns.
That, he says, may be in the near future. For now, CS Kagwe says the government has done all it can, hailing efforts by health workers countrywide. The government also plans to recruit about 1,000 more health workers who will be deployed to different parts of the country.
We have got capacity for at least 1,000 beds that we are putting in addition to whatever else have existed in the past in terms of ICU capacity.
The CS says entities in the private sector have come together to complement government efforts to contain the virus. He called on private hospitals, which have been accused of charging exorbitant fees, to also join in.
The World Bank, for example, has donated 250 ventilators. That is in addition to everything else that we are buying.
Also, the government wants local markets to think outside the box and produce some of the material needed.
When it comes to personal protective gear, we are now at a place where we believe that starting next week, we can actually be able to start manufacturing those materials ourselves.
Within Kenya, there are more than 50 companies that are capable of providing some of these medical inputs.
Katika kila shida lazima kuwe na opportunity. Kwa hivyo opportunity ya kuamsha uwezo wetu wa kujitegemea.
Counties are also preparing for the worst as they now work closely with the government to increase the capacity to fight the virus.
Tumetengeneza county emergency response teams ikiwa pamoja na county commissioners, national government ikichanganyika na county national government na county government wakiwa wanafanya kazi pamoja.
But even as the government notes that it has not gotten to those unprecedented levels that require so much manpower to contain this particular disease, it is actually preparing you for the worst if you do not follow the guidelines that it is providing on a daily basis. Kennedy Mureithi, NTV in Nairobi County.
Well, that's it for this hour, but we are working all around the 24 hours to keep you informed of what is happening with COVID-19. If there are updates, we will bring them to you immediately live from the NTV studios here in Nairobi and through our correspondents across the country. At 11 a.m., we have NTV Sasa. My name is Olive Burrows. Thank you for watching.